Hi, my name is Dr. Chuck Weber. I am a psychiatrist here at the Family Care Center, and this is going to be our What's Wednesday. Want to give a little bit of a disclaimer, and that disclaimer is that even though I'm a physician, we do not have a fiduciary responsibility. In other words, I don't have a patient-doctor relationship. All this is for medical education, not medical advice. But if you do have some questions in the comments, I can speak generally about things, and I'll try to get back to you as soon as possible. So today, what are we going to talk about? Just a little brief intro on how we approach insomnia. Insomnia means just difficulty sleeping. And there are many different causations of that. And so one of the things I really want to focus on, I'll tell you about our approach here at Family Care Center on what we do to try to approach somebody that is struggling with a difficulty falling asleep, getting to sleep, or staying asleep. And there's a lot of different modalities. But that does not discount going to your primary care, working with your family practice or family nurse practitioner to try to do all the due diligence. And what I mean by that is to do all the things that you need to do for the workup, the medical workup. We need to make sure that everything is functioning okay, metabolics are doing okay, and that you don't have an organic or a medical reason why you're not sleeping. This could be anything from sleep apnea. Sleep apnea has a lot of difficulties with the sleeping. And then of course in my realm more the PTSD, depression, anxiety, things like that. But I don't want to discount all the medical causations for that. So please do that workup, work with your primary care, and come on over to us and we'll see what we can do. And if they've missed something, we'll try to address that. Okay. Now that you've done the medical workup, where we've kind of ruled out the majority of what could cause your insomnia in a metabolic or in an organic kind of sense, when you come over to Family Care Center, what are we going to do? We're going to find out how you're doing. And how we do that is, one, just kind of getting a sleep diary, getting information or collateral from your partner to let us know how often you're going to be waking up, how long it takes you to actually get to sleep, and what things have you tried. Hopefully you've tried some over-the-counter. Hopefully your primary care has actually prescribed maybe something for you, whether or not be over-the-counter, something as simple as melatonin, or something a little bit stronger. And then we can kind of figure out what works for you. But that's only one piece of the puzzle. We really like to take this holistic approach. Okay? And that holistic approach, you are more than just a medication that's going on. So one of the things we focus on with the sleep diary is going to be what is going on with you, because you approach things differently if you have problems getting to sleep versus early morning awakenings versus the maintenance kind of portion, or why you're waking up in the middle of the night and can't get back to sleep. So we have to look at all of those things, and usually a sleep diary, collateral from your partner, and just trying to find out a little bit more information about how you are struggling. So once we have that kind of information, now we can do things probably a little bit more conservative initially, and that would be a little psychoeducation on sleep hygiene. And what I mean by sleep hygiene is change that environment, all right? So we can do a lot of things with meds, we can do talk therapy, but that environment is huge. And one of the first things, the things that I seem to have the most struggle with, is telling my patients to get the electronics out of the room, all right? So this is TV, iPad, Kindle, all those things have got to be out of the room. The bedroom should be for sleep or sex. Those are the two things that you should be doing there. If you can't fall asleep, what we usually ask people is to go into another room, go into a soft, comfortable chair, and use the least amount of light possible. Even the Kindle light can actually turn off your melatonin production and kind of start waking you up. So we want to use as little as light as possible and read something that is completely boring. After a couple decades in the military, I will tell you, Army manuals work just great. They work better than some of my meds, so go ahead and try that. All joking aside, truly, to have something that is not activating, right? The other kind of aspects with the environment is, what are you going to put in your body? So try not to eat a big meal, reducing alcohol, smoking, things like that, things that kind of activate you right before bedtime. And energy drinks, caffeine, should have nothing after 1300 or 1 o'clock p.m. So maybe you had something in the morning, maybe something for lunch, but no caffeine or energy drinks towards that latter part of the day. Exercise is still important, But if your regiment is working out at night, we understand we don't really necessarily change that, but if you have insomnia, might at least look at making that a little bit earlier. Once again, we want to make things individualized for you and how we can affect you. There's not a one-size-fits-all. There's different parameters, and we want to approach each one. Now, the other kind of things that we do here at Family Care Center is some evidence-based. So the biggest one would be cognitive behavioral therapy for insomnia. CBTI is one. Progressive relaxation, mindfulness, all of these things can kind of try to find out, once again, what is going on with you and how can we address those concerns. And there is an evidence-based approach on some of that talk therapy approach to reduce that insomnia and to kind of address the things that are going on with you. Now, the other kind of aspect is once you get to a psychiatrist or one of my psychiatric nurse practitioners, we are going to make sure that you're going to fall asleep. And we do that in a very safe way, and we use the least amount possible. And we want to have something that we want to approach, whether it be short-term, mid-term, or long-term. Because, as I said, that initiation, getting to sleep, staying asleep, or waking up early, all can take some different approaches or a little bit of each. So we want you to use us like a buffet or a smorgasbord, and we'll take those pieces that work for you, and then we're going to address your concerns. Because in the end, we need to get to sleep. So transcranial magnetic stimulation, addressing your anxiety and PTSD, all these things, it's going to be very difficult to get through those things if you can't sleep. Hard for relationships, hard for getting a work schedule going on, especially with all the things that are going on right now in our current situation. Things are very stressful. Adding that to have insomnia or difficulty sleeping suppresses your immune system and actually makes you more pro-inflammatory. So chronic pain actually gets worse during this time. So sleep is very, very important, which is why I wanted to address it first today. So we want to do everything that we can to help you. So there's a lot of different modalities. I'm not going to get into the different meds on this particular venue, but know that we are experts in our craft. We're very culturally competent. We do usually take care of mostly Department of Defense or veterans, but we now have opened up to over 20 different insurers for the civilian kind of sector. So we are here for you, serving Colorado Springs in the Front Range area, and we want to do the best that we can for you. So one of the other things that I'd like you to think about, if you can, is I'd like you to follow us on social media. We do have the Facebook, Instagram kind of things, the hashtag FC4Me, that's Foxtrot Charlie 4 Me, Mike Echo. Okay, sorry to use the military. I've already been indoctrinated, so I want you to take a look at that. Do some things on social media. If you have some comments or some questions, let us help you. Also, if you'd like to visit us on www.fcsprings.com, or intake department is 719-540-2146. Let us know what we can do for you. Thanks so much. Bye-bye.